Hi, my name is Christine, and today I'm going to be demonstrating how to administer a blood product as well as do a safety check for chest tube and a dressing change. So first, I saw on my doctor's order it says packed red blood cells 1 unit over 2 to 3 hours. I've just received the blood product from the clerk, so I'm gonna double check the blood with the label. Okay, so Jerry Atrique, that is Atriquejerry. Okay, I'm gonna look at the fin. That's 261824375. The donation number is CO51008900445Y. That matches the patient blood group is AB positive. That's AB positive here as well. The component number here is E6050VOO, and the component blood group is AB positive here, AB positive. And the date issued is today. So that now that I've compared that with the label here, I'm gonna have another nurse check this again. Okay, so they've checked it now. I'm gonna have the nurse here with me, and they're gonna look at the record of transfusion, and I'm gonna read out the labels on the blood bag. Okay, so the nurse is checking the record of transfusion. I'm gonna spell out the name. It's Atrique Jerry. It's ATRIQUEJERRY. The nurse said yes. Fin is 261824375. Okay, that's good. Patient blood group is AB positive. Good. Okay. Medical record number is 01003762. That's good. Donation number is C051008900445. Good. Component is E6050VOO, and component blood group is AB positive, and date issued is today. Okay, so that's good. The nurse clarified that that's good. I'm gonna look at my charts here. I've already seen the doctor's orders here. I'm gonna look at the admission record, making sure that the name and fin number matches. It's Atrique Jerry. It's ATRQUEJERRY. Good. And the fin number is 261824375. So that matches here. It's good. This here matches as well. I've compared that with the fin name, date of birth. I'm gonna look at the type and screen and check that as well. Good. I'm gonna look at the consent form. The patient has consented verbally, so that's good. And questions have been answered already. Okay, so now that we've looked at that, we can go to the patient's bedside. We can call the nurse now, or they can follow us later on. Okay, so upon entering, I have to do a quick safety check, making sure that the patient is comfortable. I have to put the bed rails up and that the patient is not in any distress. I'm gonna have my record of transfusion and compare that with the patient's armband. Okay, Atrique Jerry, fin number is 261824375. Good, he's 57 years old. I've confirmed that with the patient. They are good. So the nurse is here now. While the nurse is here, they can stand by the blood bags, and I'm gonna read out the patient's name and spell it out. Atrique Jerry, JERRY. That's the last name is ATRIQUE. The nurse confirms, and the fin number is 261824375, and 52 years old. Okay, the nurse confirms that that's all correct. Okay. So here we're gonna look at the blood, making sure that the right tubing has been used. Okay, so that's good. The right tubing is used. It's been primed halfway so that the blood will land on normal saline and won't hemolyze at all. Okay, and put it in the machine now. We've checked the blood already, so we can talk to the patient, tell them why we're here. My name is Christine Cruz. I'm your student nurse today, and I'm gonna be giving you your blood product here. The patient knows why, because his hemoglobin level is low. So that's why we're giving blood. The patient agrees. So yeah, they have the right to refuse. We've educated the patient. We've told the patient of any sort of reactions that they may get, such as fever, rash. If they see any of that, press the call bell. I've already taken the vital signs prior to hanging the bag, or prior to coming in, prior to getting the blood product from the clerk. I've already gotten the vital signs, so the patient is aware of all of that already. And now we can input our volume. Our primary volume or the rate that we want to put is 50 mLs per hour. We want it to be slow so we can watch for any sort of reaction. And the volume here is 358. And the other nurse can now check the rate with us and the volume. Okay, they've checked that. Now we can label this. Okay, so it's packed red blood cell,
So first thing, I'm going to do my first check, and I am going
red blood cell,
compare my physician's order and my
okay, so that's there. The nurse has confirmed this already with us, so we can connect the patient.
Right dose is 10 micrograms per ml, and that is his PCA dose every time he takes his PCA pump.
We also have flushes with us in the room.
Right route is through IV.
Okay, so we're gonna use the brown lumen here, since that's for blood. It's the biggest lumen.
And the right medication is fentanyl. So we also have our fentanyl.
Clean that for 30, let it dry for 15.
So I'll just check the expiry date while we're looking at it, so there's not expired.
Making sure that there's no air bubbles here.
Fentanyl infusion and
Open the clamp, look for blood return. I see blood return, and push pause.
So I'm going to put my physician's sheet away, and I'm going to go to
Good. Now, while this is still connected to the normal saline, we can connect the blood.
Doses of 10 to 50
That's still clean, so now we can connect this
in 5 to 10 minutes, which is
here. We've checked the rate already with the other nurse, so we can confirm it.
compatible with the 5.
And now we can start it, making sure that all the clamps are open.
So that's perfect.
So now we have to stay with the patient for 15 minutes, making sure that there are no adverse reactions. And after the 15 minutes, we have to take the patient's vital signs again, making sure that the temperature is within the normal range and everything is good, that they're not feeling dizzy or feeling any itchiness. And we have to make sure that we see 3 drops here. First 3 drops. Okay. And so we are good with this. We can now move on to our next task. Before we, after the 15 minutes, we can increase the rate, the remaining rate, and then the other nurse can check the rate as well and confirm it with us if there are no reactions at all. So we have to do exit safety check, make sure that the patient is comfortable.
Being careful not to tear any edges, and then we're going to withdraw.
And now we can do our chest tube care.
10 mLs of normal.
So just follow
For chest tube, we have to make sure that the wall suction is on low.
I went through a
We have to trace the tubing here, making sure there are no kinks.
So, yeah, they're 40 mLs, and now we want to instill in there 10 mLs
I don't see any
of
kinks.
fentanyl, because that is what the drug monograph says.
Make sure that the
Now,
clamps
I
are
want
here,
syringe here.
and that we have a bottle of normal saline in this room, just in case that the tubing gets disconnected. On here, we have to look at the drainage. We have to take note of the color. If there are any clumps, we have to record the level, the time and date, and our initials. We have to look at the water seal chamber. If there's any bubbling, that would indicate air leaks. We have to look at the titling that's moving up and down whenever the patient takes deep breath in and out. We have to make sure that the orange wall is here and that it's on 20 centiliters of water. So that's good. Making sure that the system is below the chest tube, the patient's chest tube. Okay, so we assess that. And now I'm going to tell my patient that I'm going to be changing the chest tube dressing. So I can get my table here. I'm just going to get my equipment here. I'm going to adjust the patient's bed to a semi-forward position. I'm going to raise their arm. Okay, so I'm just going to look at the side there. Palpate for any subcutaneous emphysema. I don't feel any popping, so that's good. I'm going to grab alcohol here, wash my hands. Okay, so now we can set up our equipment. Is it okay if I put some of my equipment here? Okay.
Micrograms of fentanyl as per our drug monograph.
I'm just gonna grab.
And I'm going to fill that into my
Wash my hands again.
40 milliliter bag. First one, I'm going to do a second check in row against my mark, and I'm going to have a second nurse come in and do this with me, just because I am a student nurse.
I'm gonna adjust the bed a little higher.
Someone to watch me, as well as because this is a high alert medication. So we need someone to watch that. So I had my second nurse come, they checked it against the vial, 10 mLs, 10 mLs,
Blue forceps.
500 micrograms of fentanyl. We have the right patient, and they check the drug monograph as well. 40 mL of normal saline in this mini bag. That works. So we're ready then to instill the normal saline, or the fentanyl into the normal saline mini bag. I'm just going to lift up your arm, okay, and start your swab it for
Set up my trash can here. Okay, and I can drop all of the equipment that I need in the tray.
So here I'm going to make sure that it's
Make sure not to touch the IV drain gauze.
Titling. I don't want to put a bubble in there, and if there was, I would just go I'll show you that.
And at this time,
And we need the jello net.
because I'm only personally. And so just going through my label here, I have the patient Tyson Ward. Tyson Ward signs up with her the drug name is
There we
fentanyl.
go. Oh, that should be in the 1-inch border.
Total dose is 500 micrograms of fentanyl. Our volume is 50 mL. Our dilute is normal saline. Our concentration per ml is 10 micrograms.
And now we can
per
put our
ml, and
normal
that lines
saline.
up with what the drug monograph says. Date today is 15th March, and the time is now.
Good.
And that is the right
So
time.
now
give
we
this
can wear our
a second.
gloves.
And I also added on the label. That
I've already
there's a
washed my
5-minute
hands.
period, that there is 10 micrograms bolus, and that there is 0 loading dose. So I'm going to put this label onto
Okay,
the
now we can remove the dressing. We've assessed if there's any
So I'm just going to and then I will document that I have done this and let the next nurse coming on know what is going on. Very good. So I'm going to leave that now. I'm going to move on to doing the chest tube dressing. So now I am entering the room, doing hand hygiene, doing an entrance safety check. Hi there, Tyson. My name is Erica. I'm
sure to
a
stabilize the tube.
doing
Removing the
dressing
dressing.
change for you today.
There we go.
Um,
Throw this in the trash, and while we're wearing
Safety
gloves,
check,
we
make
can
sure
also
he's
remove the
real
jello
fast.
net,
I'll do that
making
before I
sure
leave. Make sure that he's not in any distress.
Oh, we remove the jello net,
and
throw the blue forceps along with our gloves,
suction is all on, which it is, and that it is on.
wash our hands,
which it also is.
wear another set
follow
of
the line
gloves.
all the way to the bedside here, making sure that there is no leaks or leaks or kinks or anything wrong with this tubing. Making sure that it goes all the way to the chest
Here we go.
collection chamber.
So now we
And that
can
this is
start to
lower than
clean
suction site. That's
the
very important.
site.
Well, in here I'm going to check that there's
So
some
we're gonna
extra
use the
normal
2x2.
that it is set at 20 centimeters of water, and that there's a red ball showing there because that means that, or
So?
orange, sorry, that it is working.
We do the
I'm going to monitor the drainage and make sure that it has
first
been
in a
marked
circular
on the
motion.
shift change, as well as like what color and the amount. And then I'm going to check in the air leak. Yeah, where it shows if there's an air leak or not, and just check to see if there is
One
bubbling.
more
If there is
time.
bubbling, that means for extensive bubbling. There will always be like some champagne bubbles and some tidling that go up and down if the patient is breathing. But if there is more than that bubbling, then we know there's an air leak. And in that case, I would check.
And now we can clean the
and I would
tube
begin at the patient's
with a 4x4.
as close to the chest tube as I could, and I would clamp the forceps here.
There we go. And now we can dry.
And then I would take another look there, and if there were still those bubbles, then I would know that the air leak is below that. And if that eliminated the bubbles, I would know that the air leak was within the between the forceps or above. And from that we can figure out
We
where
can
the
dry.
air
This
leak
is dry, so
and adapt and form a solution. So we found where the
now
air
we
leak
can
is,
get our
we,
jello net here.
assess that, and it is all good to go. So we want to make sure that we keep these forceps close at hand at all times. All right, so then we're going to continue on with our chest tube dressing change here, since we've assessed that everything is good. You can make sure you're comfortable here, Tyson. Doing all right? Very good. I have him at a center.
And just put this
just for
around
ease of access.
this side.
I'm going to bring my dressing sheet.
Sure that it's tight there. And it's flat.
All right. One on here.
Now it's sealed. We can get our
I'm going to start now with.
drain sponges
All right,
now.
so I'm going to begin with removing the
Put
dressing.
that on top.
Where's my garbage? Here's the garbage can. Let me know
Another
if
one.
this is too much here, Tyson. I'll try to be as gentle as possible.
In another direction.
So I'm going to remove this dressing here, making sure not to pull too much
We
on
can
the
now
tube.
put a 4x4 on top
Kind
of
of
that.
stabilize it here just to, ensure that
That's good.
we're not pulling too much on there.
There we go.
Right?
And now I've already labeled time and date and initial my cloth tape,
Time to remove this dressing here.
making sure that it's a fully occlusive dressing.
So now I'm going to
Push all the air out here.
All right, so it is quite well attached here. So this tube would be stitched in a real person, but in this situation it's not. And the bandage is very hard to take out. So I would, in this situation, I would leave it for now. I would continue
Put
to
another
change dressing, and
one,
later on I would come back
making
in
sure to
with
tent
scissors
the
and
tubing.
bandage off, or the dressing off, since I'm unable
Just
to.
so if the patient accidentally pulls on it, it won't pull on the side, it would only pull on the tape here.
See if there's much drainage. I'm going to open up my sterile field.
where's right further away.
Squeeze
So I
that.
started from
There we go.
there, started closest to the actual.
So that's good now. The patient is comfortable. We can cover them up, put them in the position that they were on earlier. We can document that we've given the blood earlier as well as done the dressing change.
Get rid of that.
We can put the bed rails up, give the cowbell to the patient, making sure that they're comfortable. We're gonna stay here for 15 minutes because of the blood, and we have to make sure everything's good. We have to clean up. That's it.